Question 1. George Kent is a 54-year-old widower with a history of chronic obstructive pulmonary disease and was rushed to the emergency department with increasing shortness of breath, pyrexia, and a productive cough with yellow-green sputum. He has difficulty in communicating because of his inability to complete a sentence. One of his sons, Jacob, says he has been unwell for 3 days. Upon examination, crackles and wheezes can be heard in the lower lobes. He has a tachycardia and a bounding pulse. Measurement of arterial blood gas shows pH 7.3, PaCO 268 mm Hg, Co 328 mmol/L, and Pau 260 mm Hg. How would you interpret this? A. Respiratory acidosis, uncompensated. B. Respiratory acidosis, partially compensated. C. Metabolic alkalosis, uncompensated. D. Metabolic acidosis, partially compensated. Question 1 Answer: B. Respiratory acidosis, partially compensated. Question 1 Explanation: the patient has respiratory acidosis, raised carbon dioxide, resulting from an acute exacerbation of chronic obstructive pulmonary disease, with partial compensation. Question 2 Carl, an elementary student, was rushed to the hospital due to vomiting and a decreased level of consciousness. The patient displays slow and deep, Kussmaul breathing, and he is lethargic and irritable in response to stimulation. He appears to be dehydrated, his eyes are sunken and mucous membranes are dry, and he has a 2-week history of polydipsia, polyuria, and weight loss. Measurement of arterial blood gas shows pH 7.0, Pau 290 mm Hg, PaCO 223 mm Hg, and Co 312 mmol/L. Other results are Na plus 126 mmol/L, K plus 5 mmol/L, and Cl minus 95 mmol/L. What is your assessment? A. Respiratory acidosis, uncompensated. B. Respiratory acidosis, partially compensated. C. Metabolic alkalosis, uncompensated. D. Metabolic acidosis, partially compensated. Question 2 Answer: D. Metabolic acidosis, partially compensated. Question 2 Explanation: the student was diagnosed having diabetes mellitus. The results show that he has metabolic acidosis, low CO3, with respiratory compensation, low CO2. Question 3 A cigarette vendor was brought to the emergency department of a hospital after she fell into the ground and hurt her left leg. She is noted to be tachycardic and tachypneic. Painkillers were carried out to lessen her pain. Suddenly, she started complaining that she is still in pain and now experiencing muscle cramps, tingling, and paresthesia. Measurement of arterial blood gas reveals pH 7.6, Pau 120 mm Hg, PaCO 231 mm Hg, and Co 325 mmol/L. What does this mean? A. Respiratory alkalosis, uncompensated. B. Respiratory acidosis, partially compensated. C. Metabolic alkalosis, uncompensated. D. Metabolic alkalosis, partially compensated. Question 3 Answer: A. Respiratory alkalosis, uncompensated. Question 3 Explanation: the primary disorder is acute respiratory alkalosis, low CO2, due to the pain and anxiety causing her to hyperventilate. There has not been time for metabolic compensation. Question 4 Ricky's grandmother is suffering from persistent vomiting for 2 days now. She appears to be lethargic and weak and has myalgia. She is noted to have dry mucous membranes and her capillary refill takes (4 seconds. She is diagnosed as having gastroenteritis and dehydration. Measurement of arterial blood gas shows pH 7.5, Pau 285 mm Hg, PaCO 240 mm Hg, and Co 334 mmol/L. What acid-base disorder is shown? A. Respiratory alkalosis, uncompensated. B. Respiratory acidosis, partially compensated. C. Metabolic alkalosis, uncompensated. D. Metabolic alkalosis, partially compensated. Question 4 answer, C. Metabolic alkalosis, uncompensated. Question 4 explanation. The primary disorder is uncompensated metabolic alkalosis, high CO3. As CO2 is the strongest driver of respiration, it generally will not allow hypoventilation as compensation for metabolic alkalosis. Question 5. Mrs. Johansson, who had undergone surgery in the post-anesthesia care unit, PICU, is difficult to arouse 2 hours following surgery. Nurse Florence in the PICU has been administering morphine sulfate intravenously to the client for complaints of post-surgical pain. The client's respiratory rate is 7 per minute and demonstrates shallow breathing. The patient does not respond to any stimuli. The nurse assesses the ABCs, remember airway, breathing, circulation, and obtains ABG stat. Measurement of arterial blood gas shows pH 7.10, PaCO 270 mm Hg and HO 324 mg/L. What does this mean? A. Respiratory alkalosis, partially compensated. B. Respiratory acidosis, uncompensated. C. Metabolic alkalosis, partially compensated. D. Metabolic acidosis, uncompensated. Question 5 answer, B. Respiratory acidosis, uncompensated. Question 5 explanation. The results show that Mrs. Johansson has respiratory acidosis because of decreased pH and increased PaCO2, which mean acidic in nature. Meanwhile, it is uncompensated because HO3 is within the normal range. Question 6. Baby Angela was rushed to the emergency room following her mother's complaint that the infant has been irritable, difficult to breastfeed and has had diarrhea for the past 3 days. The infant's respiratory rate is elevated and the fontanelles are sunken. The emergency room physician orders ABGs after assessing the ABCs. The results from the ABG results show pH 7.39, PaCO 227 mm of mercury and HO 319 mg/L. What does this mean? A. Respiratory alkalosis, fully compensated. B. Metabolic acidosis, uncompensated. C. Metabolic acidosis, fully compensated. D. Respiratory acidosis, uncompensated. Question 6 answer, C. Metabolic acidosis, fully compensated. Question 6 explanation. Baby Angela has metabolic acidosis due to decreased CO3 and slightly acidic pH. Her pH value is within the normal range, which made the result fully compensated. Question 7. Mr. Wales, who underwent post-abdominal surgery, has a nasogastric tube. The nurse on duty notes that the nasogastric tube, NGT, is draining a large amount, 900 cc in 2 hours, of coffee ground secretions. The client is not oriented to person, place, or time. The nurse contacts the attending physician and stat ABGs are ordered. The results from the ABGs show pH 7.57, PaCO 237 mm of mercury and HO 330 mg/L. What is your assessment? A. Metabolic acidosis, uncompensated. B. Metabolic alkalosis, uncompensated. C. Respiratory alkalosis, uncompensated. D. Metabolic alkalosis, partially compensated. Question 7 answer, B. Metabolic alkalosis, uncompensated. Question 7 explanation. The postoperative client's ABG results show that he has metabolic alkalosis because of an increased pH and CO3. It is uncompensated due to the normal PaCO2, which is within 35 to 45 mm of mercury. Question 8. Client Z is admitted to the hospital and is to undergo brain surgery. The client is very anxious and scared of the upcoming surgery. He begins to hyperventilate and becomes very dizzy. The client loses consciousness and the stat ABGs reveal pH 7.61, PaCO 222 mm of mercury and HO 325 mg/L. What is the ABG interpretation based on the findings? A. Metabolic acidosis, uncompensated. B. Respiratory alkalosis, partially compensated. C. Respiratory alkalosis, uncompensated. D. Metabolic alkalosis, partially compensated. Question 8 Answer, C. Respiratory alkalosis, uncompensated. Question 8 Explanation. The results show that client Z has respiratory alkalosis since there is an increase in the pH value and a decrease in PaCO2, which are both basic. It is uncompensated due to the normal CO3, which is within 20 to 26 mg/L. Question 9. 3-year-old Adrian is admitted to the hospital with a diagnosis of asthma and respiratory distress syndrome. The mother of the child reports to the nurse on duty that she has witnessed slight tremors and behavioral changes in her child over the past 4 days. The attending physician orders routine ABGs following an assessment of the ABCs. The ABG results are pH 7.35, PaCO2 72 mm of mercury and CO3 38 mg/L. What acid-base disorder is shown? A. Respiratory acidosis, uncompensated. B. Respiratory acidosis, fully compensated. C. Respiratory alkalosis, fully compensated. D. Metabolic alkalosis, partially compensated. Question 9 Answer, B. Respiratory acidosis, fully compensated. Question 9 Explanation. The patient has respiratory acidosis, raised carbon dioxide, resulting from asthma and respiratory distress syndrome, with compensation having normal pH value within 7.35 to 7.45, increased PaCO2 which is acidic and increased CO3 which is basic. Question 10. Anne, who is drinking beer at a party, falls and hits her head on the ground. Her friend Liza dials 911 because Anne is unconscious, depressed ventilation, shallow and slow respirations, rapid heart rate, and is profusely bleeding from both ears. Which primary acid-base imbalance is Anne at risk for if medical attention is not provided? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. Question 10 Answer, C. Respiratory acidosis. Question 10 Explanation. One of the risk factors of having respiratory acidosis is hypoventilation, which may be due to brain trauma, coma, and hypothyroidism or myxedema. Other risk factors include COPD, respiratory conditions such as pneumothorax, pneumonia and status asthmaticus. Drugs such as morphine and XO4 toxicity are also risk factors of respiratory acidosis. Question 11. Dave, a 6-year-old boy, was rushed to the hospital following her mother's complaint that her son has been vomiting, nauseated and has overall weakness. After series of tests, the nurse notes the laboratory results: potassium, 2.9 mg. Which primary acid-base imbalance is this boy at risk for if medical intervention is not carried out? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. Question 11 Answer, D. Metabolic alkalosis. Question 11 Explanation. Vomiting, hypoglycemia, overdosage of NaCO3 and NGT suctioning are considered risk factors of metabolic alkalosis. Question 12. An old beggar was admitted to the emergency department due to shortness of breath, fever, and a productive cough. Upon examination, crackles and wheezes are noted in the lower lobes. He appears to be tachycardic and has a bounding pulse. Measurement of arterial blood gas shows pH 7.2, PaCO2 66 mm Hg, CO3 27 mmol/L, and PaO2 65 mm Hg. As a knowledgeable nurse, you know that the normal value for pH is A. 7.20, B. 7.30, C. 7.40, D. 7.50. Question 12 Answer, C. 7.40. Question 12 Explanation. Normal blood pH must be maintained within a narrow range of 7.35–7.45 to ensure the proper functioning of metabolic processes and the delivery of the right amount of oxygen to tissues. Acidosis refers to an excess of acid in the blood that causes the pH to fall below 7.35, and alkalosis refers to an excess of base in the blood that causes the pH to rise above 7.45. Question 13. Liza's mother is seen in the emergency department at a community hospital. She admits that her mother is taking many tablets of aspirin, salicylates, over the last 24-hour period because of a severe headache. Also, the mother complains of an inability to urinate. The nurse on duty took her vital signs and noted the following: temp equals 97.8 degrees Fahrenheit, apical pulse equals 95, respiration equals 32 and deep. Which primary acid-base imbalance is the gentleman at risk for if medical attention is not provided? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. Question 13. Answer: C. Metabolic acidosis. Question 13. Explanation: salicylate overdose causes a high anion gap metabolic acidosis in both children and adults. Adults commonly develop a mixed acid-base disorder as a respiratory alkalosis due to direct respiratory center stimulation occurs as well. This second disorder is uncommon in children. Question 14. A patient who is hospitalized due to vomiting and a decreased level of consciousness displays slow and deep, cusmal breathing, and he is lethargic and irritable in response to stimulation. The doctor diagnosed him of having dehydration. Measurement of arterial blood gas shows pH 7.0, PaO 290 mm Hg, PaCO 222 mm Hg, and CO 314 mmol/L. Other results are Na plus 120 mmol/L, K plus 2.5 mmol/L, and Cl minus 95 mmol/L. As a knowledgeable nurse, you know that the normal value for PaCO2 is A. 22 mm Hg, B. 36 mm Hg, C. 48 mm Hg, D. 50 mm Hg. Question 14. Answer: B. 36 mm Hg. Question 14. Explanation: the normal range for PaCO2 is from 35 to 145 mm Hg. Question 15. A company driver is found at the scene of an automobile accident in a state of emotional distress. He tells the paramedics that he feels dizzy, tingling in his fingertips, and does not remember what happened to his car. Respiratory rate is rapid at 34/minute. Which primary acid-base disturbance is the young man at risk for if medical attention is not provided? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. Question 15. Answer: B. Respiratory alkalosis. Question 15. Explanation: hyperventilation is typically the underlying cause of respiratory alkalosis. Hyperventilation is also known as overbreathing. When someone is hyperventilating, they tend to breathe very deeply or very rapidly. Question 16. An old man was admitted to hospital in a coma. Analysis of the arterial blood gave the following values: PaCO 216 mm Hg, CO 35 mmol/L, and pH 7.1. As a well-rounded nurse, you know that the normal value for CO3 is A. 20 mmol/L, B. 24 mmol/L, C. 29 mmol/L, D. 31 mmol/L. Question 16. Answer: B. 24 mmol/L. Question 16. Explanation: the normal value for bicarbonate, CO3, is 22 to 216 mmol/L or mg/L. It may vary slightly among different laboratories. The given values show the common measurement range of results for these tests. Some laboratories use different measurements or may test different specimens. Question 17. In a patient undergoing surgery, it was vital to aspirate the contents of the upper gastrointestinal tract. After the operation, the following values were acquired from an arterial blood sample: pH 7.55, CO2 52 mm Hg and HO3 40 mmol/L. What is the underlying disorder? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. Question 17 Answer: D. Metabolic alkalosis. Question 17 Explanation: NGT suctioning, vomiting, hypoglycemia and overdosage of NACO3 are considered risk factors of metabolic alkalosis. Question 18. A mountaineer attempts an assault on a high mountain in the Andes and reaches an altitude of 5,000 meters, 16,400 feet, above sea level. What will happen to his arterial CO2 and pH? A. Both will be lower than normal. B. The pH will rise and CO2 will fall. C. Both will be higher than normal due to the physical exertion. D. The pH will fall and CO2 will rise. Question 18 Answer: B. The pH will rise and CO2 will fall. Question 18 Explanation: The mountaineer will suffer from a respiratory alkalosis. The decline in the PO2 with altitude will stimulate breathing to offset the hypoxia. Carbon dioxide is driven from the blood faster than it is produced in the tissues, so CO2 falls and pH rises. Question 19. A young woman is found comatose, having taken an unknown number of sleeping pills an unknown time before. An arterial blood sample yields the following values: pH 6.90, CO3 13 mg/liter and PaCO 268 mm of mercury. This patient's acid-base status is most accurately described as A. Metabolic acidosis. B. Respiratory acidosis. C. Simultaneous respiratory and metabolic acidosis. D. Respiratory acidosis with complete renal compensation. Question 19 Answer: C. Simultaneous respiratory and metabolic acidosis. Question 19 Explanation: Whenever the PCO2 and HCO3 are abnormal in opposite directions, one above normal while the other is reduced, a mixed respiratory and metabolic acid-base disorder exists. When the PCO2 is elevated and the HCO3 reduced, respiratory acidosis and metabolic acidosis coexist. Question 20. A mother is admitted in the emergency department following complaints of fever and chills. The nurse on duty took her vital signs and noted the following: temp equals 100 degrees Fahrenheit, apical pulse equals 95, respiration equals 20 and deep. Measurement of arterial blood gas shows pH 7.37, PaO 290 mm Hg, PaCO 240 mm Hg, and HCO3 24 mmol/L. What is your assessment? A. Hyperthermia. B. Hyperthermia and respiratory alkalosis. C. Hypothermia. D. Hypothermia and respiratory alkalosis. Question 20 Answer: A hyperthermia. Question 20 Explanation: An individual is considered to have hyperthermia if he or she has a temperature of greater than 37.5 or 38.3 degrees Celsius, 99.5 or 200.9 degrees Fahrenheit. Measurement of arterial blood gases are normal. Question 21. In acid-base balance, the normal plasma PCO2 and bicarbonate levels are disturbed. Match the changes in these parameters given below with the disorders in the drop-down list. Low plasma PaCO2. A. Metabolic acidosis. B. Respiratory alkalosis. C. Metabolic alkalosis. D. Respiratory acidosis. Question 21 Answer: B. Respiratory alkalosis. Question 21 Explanation: Excessive pulmonary ventilation decreases hydrogen ion concentration and thus causes respiratory alkalosis. It can become dangerous when it leads to cardiac dysrhythmias caused partly by a decrease in serum potassium levels. Question 22. High plasma PaCO2A. Metabolic acidosis. B. Respiratory alkalosis. C. Metabolic alkalosis. D. Respiratory acidosis. Question 22 Answer. D. Respiratory acidosis. Question 22 Explanation. An excess of carbon dioxide, hypercapnia, can cause carbon dioxide narcosis. In this condition, carbon dioxide levels are so high that they no longer stimulate respirations but depress them. Question 23, Decreased plasma bicarbonate, CO3, A. Metabolic acidosis. B. Respiratory alkalosis. C. Metabolic alkalosis. D. Respiratory acidosis. Question 23 Answer. A metabolic acidosis. Question 23 Explanation. The body compensates by using body fat for energy, producing abnormal amounts of ketone bodies. In an effort to neutralize the ketones and maintain the acid-base balance of the body, plasma bicarbonate is exhausted. This condition can develop in anyone who does not eat an adequate diet and whose body fat must be burned for energy. Symptoms include headache and mental dullness. Question 24, Increased plasma bicarbonate, CO3, A. Metabolic acidosis. B. Respiratory alkalosis. C. Metabolic alkalosis. D. Respiratory acidosis. Question 24 Answer. C. Metabolic alkalosis. Question 24 Explanation. In metabolic alkalosis, breathing becomes depressed in an effort to conserve carbon dioxide for combination with water in the blood to raise the blood level of carbonic acid. Symptoms include confusion, dizziness, numbness or tingling of fingers or toes. Question 25. What two organs in the body serve as a compensatory function to maintain acid-base balance? A. Kidneys and lungs. B. Lungs and spleen. C. Heart and liver. D. Gallbladder and appendix. Question 25 Answer. A. Kidneys and lungs. Question 25 Explanation. The carbonic acid concentration is controlled by the amount of carbon dioxide excreted by the lungs. The bicarbonate concentration is controlled by the kidneys, which selectively retain or excrete bicarbonate in response to the body's needs. Question 26, Arterial blood gas, ABG, measurement will give the information needed to determine if the primary disturbance of acid-base balance is respiratory or metabolic in nature. A. True. B. False. C. Both carbonic acid excess and deficit only. D. Both bicarbonate excess and deficit only. Question 26 Answer. A true. Question 26 Explanation. ABGs are blood tests that are useful in identifying the cause and extent of the acid-base disturbance and in guiding and monitoring treatment. Question 27. The major effect of acidosis is overexcitement of the central nervous system. A. True. B. False. C. Maybe. D. Both acidosis and alkalosis result in overexcitement of the central nervous system. Question 27 Answer. B. False. Question 27 Explanation. The major effect is a depression of the central nervous system, as evidenced by disorientation followed by coma. Question 28. Alkalosis is characterized by overexcitement of the nervous system. A. True. B. False. C. The major effect of alkalosis is a depression of the central nervous system. D. Both acidosis and alkalosis result in overexcitement of the central nervous system. Question 28 Answer. A true. Question 28 Explanation. The muscles may go into a state of tetany and convulsions. Question 29. The human body functions optimally in a state of homeostasis. A. True. B. False. C. Maybe. D. Homeostasis has nothing to do with metabolic balance. Question 29 Answer. A true. Question 29 Explanation. The maintenance of acid-base balance, which in one part of homeostasis, is evidenced by an arterial plasma pH value of 7.35–7.45. Many mechanisms in the body work together to achieve and maintain this delicate narrow range of pH that is essential for normal cell function. Question 30. Acids have no hydrogen ions and are able to bind in a solution. A. True. B. False. C. Acid is a substance that is not capable of donating hydrogen ions. D. Acids and bases have nothing to do with hydrogen ions. Question 30 Answer, B. False. Question 30 Explanation. Acids are substances having one or more hydrogen ions that can be liberated into a solution. Bases are substances that can bind hydrogen ions in a solution. Question 31. Match the acid-base status of the following blood samples to the disorders in the drop-down list. PaCO2 values are mHg and bicarbonate values in mol/L. pH 7.57, PaCO2 22, Co3 17. A. Respiratory acidosis, partially compensated. B. Respiratory alkalosis, uncompensated. C. Metabolic acidosis, partially compensated. D. Respiratory alkalosis, partially compensated. Question 31 Answer, D. Respiratory alkalosis, partially compensated. Question 32, pH 7.39, PaCO2 44, Co3 26A. Respiratory acidosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Normal. Question 32 Answer, D. Normal. Question 33, pH 7.55, PaCO2 25, Co3 22A. Respiratory acidosis, partially compensated. B. Respiratory alkalosis, uncompensated. C. Metabolic alkalosis, partially compensated. D. Metabolic acidosis, uncompensated. Question 33 Answer, B. Respiratory alkalosis, uncompensated. Question 34, pH 7.17, PaCO2 48, Co3 36A. Respiratory acidosis, uncompensated. B. Metabolic acidosis, partially compensated. C. Respiratory alkalosis, partially compensated. D. Respiratory acidosis, partially compensated. Question 34 Answer, D. Respiratory acidosis, partially compensated. Question 35, pH 7.34, PaCO2 24, Co3 20A. Respiratory acidosis, partially compensated. B. Metabolic acidosis, partially compensated. C. Metabolic acidosis, uncompensated. D. Metabolic alkalosis, partially compensated. Question 35 Answer, B. Metabolic acidosis, partially compensated. Question 36, pH 7.64, PaCO2 25, Co3 19A. Respiratory acidosis, uncompensated. B. Respiratory alkalosis, partially compensated. C. Respiratory alkalosis, uncompensated. D. Metabolic alkalosis, partially compensated. Question 36 Answer, B. Respiratory alkalosis, partially compensated. Question 37, pH 7.45, PaCO2 50, Co3 30A. Metabolic alkalosis, fully compensated. B. Respiratory alkalosis, fully compensated. C. Metabolic alkalosis, partially compensated. D. Respiratory acidosis, partially compensated. Question 37 Answer, A. Metabolic alkalosis, fully compensated. Question 38, pH 7.6, PaCO2 53, Co3 38A. Metabolic alkalosis, partially compensated. B. Metabolic alkalosis, fully compensated. C. Respiratory acidosis, partially compensated. D. Respiratory alkalosis, fully compensated. Question 38 Answer, A. Metabolic alkalosis, partially compensated. Question 39, pH 7.5, PaCO2 19, Co3 22A. Respiratory alkalosis, partially compensated. B. Metabolic alkalosis, partially compensated. C. Respiratory acidosis, uncompensated. D. Respiratory alkalosis, uncompensated. Question 39 Answer, D. Respiratory alkalosis, uncompensated. Question 40, pH 7.4, PaCO2 59, Co3 35A. Respiratory acidosis, uncompensated. B. Metabolic alkalosis, uncompensated. C. Respiratory acidosis, fully compensated. D. Metabolic alkalosis, partially compensated. Question 40 Answer: C. Respiratory acidosis, fully compensated.